Good afternoon, everyone. Good afternoon, Cebu. Welcome to today's episode of SunStar Cebu's Beyond the Ballot 2025. I'm Mildred Galarpe.
And I'm DJ Moises.
In today's episode, we shift our attention to the party list race, a vital part of our democratic process where sectoral groups seek representation in Congress.
This time, we are putting the spotlight to a party list group that aims to champion health and public service across the nation. 152 Heal PH Partylist.
The goal of this conversation is simple: to give you, the voter, a clear and deeper understanding of what the 152 Heal PH Partylist stands for, what they hope to accomplish in Congress, and who are the people behind it.
So the format remains the same. The first 30 minutes will be a conversation with each of our guests from the party list. And then the remaining time, we will go over the 5 core questions, each to be answered within 2 minutes and 30 seconds.
We've shared the questions with them a day ahead to ensure fairness and transparency across all our interviews.
Candidate profile. Each nominee will share their background, role within the party list, key advocacies, and the reasons why they are running for a seat in Congress under their party list banner. This segment allows viewers to understand who they are, what they stand for, and who they aim to represent. 5 core questions. In the second half of the interview, each nominee will respond to 5 essential questions that highlight their legislative priorities, plans, and policy positions. Each answer must be given within a 2-minute and 30-second time limit to ensure fairness and focus.
And now let's welcome the individuals who make up the leadership of 152 Heal PH Party List.
Joining us today is no other than Dr. Eric Tayag, General Bennie De Leon, Dr. Andrew Fick Jimenez. Good afternoon, sir.
Good afternoon, Mildred. Good afternoon,
sir.
Good afternoon.
Okay. Who doesn't know Dr. Tayag?
Well, maybe I can reintroduce myself.
Yes,
today.
perfect.
Yeah, maybe
Okay.
each of you can introduce
Yes,
yourself.
I'm Dr. Eric Tayag. I served the Department of Health for the past 35 years, and I retired last year. And all 3 of us share the same zodiac sign. And I told you earlier that it was my birthday last April 4.
Yes.
Now, in the 35 years that I have served government, I've actually served 7 presidents of this republic and 18 secretaries of health. And I'm an infectious disease specialist and epidemiologist. And I retired as an Undersecretary of Health. And I also became an official spokesperson.
Yes.
And now, the first nominee of the Heal PH Party List, number 152.
Okay. Dr. Bennie, General Bennie. See, doctor lahat eh.
Bagay, ang lahat sa aming tawag, doktor na dahil member ng Heal PH. I'm Major General Benito Antonio Templo De Leon, retired. And I had 44 years in government service and retired 3 times in government. My first was as a military officer, a retired military officer, and held the rank of Major General. And the last assignment I've had in the military was as the Inspector General of the Armed Forces of the Philippines. After that, I was taken as department head in charge of public safety and security of Davao City. And there I served for, again, 3 years. And then the last that I've served in government was as Undersecretary for Environmental Enforcement of the Department of Environment and Natural Resources. And with my background in policy formulation and policy implementation, I was asked to join or invited to join Heal PH Partylist 152 and hoping to serve again the Filipino people. Thank you.
Yes. And good morning, good evening, and good afternoon to all. I'm Dr. Andrew Jimenez. I'm an optometrist, and at the same time, I'm a registered nurse here in the Philippines and also in Australia. Now, I have been working in Australia for several years, 6 years or more. And I saw the difference of our healthcare system between Australia and Philippines. And also, we want to somehow bring that system, no, that benefit from other countries to our country. So that's why I was invited to join Heal PH Partylist 152, hoping that we can somehow integrate that healthcare system in our country.
Okay. My first
Actually,
question-
Mildred, I can read your mind.
Oh,
How individually are we now sitting here with you with different backgrounds?
yes.
Can you imagine these 3 bottles of water? Okay, they're separate.
Yes.
It can be another bottle, for example, but because we are united with one good purpose. And then you ask us, what is that?
What is the main advocacy or the main what you call this
Platform.
of
The platform.
Heal PH?
Okay, our bottom line is, may pag-asa ka sa health card. Yes, you have your hopes for a health card. Exactly what is this health card?
Yeah.
It goes back to universal health care. The purpose and goal of universal health care is that every Filipino has access to affordable, quality medical services anywhere, every time. And so we at the Heal PH Partylist wanted to make sure that we understand what universal healthcare is, what's the progress, what are the gaps. Now that it's on its 6th year, the law says that there is an oversight committee that's going to review the progress on the implementation of Universal Healthcare Act. And we just found out gaps. One of them is the high out-of-pocket cost. The health expenditure, for example, is 1.4 trillion pesos. The money that can pay for these health expenditures, you add all up, the DOH budget, field health funds, HMO funds, senior citizen discounts, everything, it's only 700 billion pesos. The rest is out of pocket. That is where we position the health card. It will supplement everything that government can pay. It's coming from taxes, and the health card makes sure that anyone who gets sick and you have this huge bill, and then it already deducts everything, and still you have this amount to pay, the health card is your guarantee. It's unlimited. It's going to be with the poor people at first, public hospitals, then it grows until every one of us will get the benefits from that health card.
The health card will be funded by government.
It's taxes, it's going to be from multiple sources. In fact, it can be just like an HMO card. It can be similar to field health. But the thing is, it addresses one thing, which is not addressed by the others. It's the out-of-pocket cost. We remove it from your burden.
So, how ready is also our healthcare system now, such as our public hospitals? Now, how ready are they also to cater, to those who will avail the health card?
Oh, that's a good question, because Andrew here has his sights on the certain elements of the universal healthcare, as well as Bennie. Bennie, for example, says look at the sites on infrastructure. Bennie, maybe you want to share what we found out on the gaps on the health
Yes.
infrastructure and how our party list is going to
Address
support all the initiatives
That's
regarding
correct.
this?
I think initially we have to address part of what we have to advocate for an improved healthcare system in our country is the infrastructure or the facilities that have to cater to the or attend to the medical services of our people. One is the absence of the rural healthcare facilities in the remote areas. I refer to the barangays and the local government units. We understand that the national government has now pulled out its support to the barangay health clinics in giving priority in establishing special hospital services in the metropolitan centers. So that pulls away the focus of national government and leaving the local governments to attend to the barangays of the local government needs. And there's a big gap that has to be addressed. And if I refer to where I came from, which is as a retired military officer, there is only one hospital that caters to the retired military officers that is found in Quezon City, providing for free medical attention, medicines, and operations to retired military officers. And that is found in Quezon City. It is the Veterans Medical Memorial Center. So you will find that retired personnel of the armed forces coming from the other parts of the country as far as Mindanao or Northern Luzon and Visayas have to travel those distances just to avail the free medical services. And on top of that, it is only the retired military officers that are given such benefit. The other members of the uniformed services, such as the police, the BGMP, the Bureau of Fire, the Coast Guard, are not also provided when they retire. So that alone, which I come from, there is already a significant gap that national government has to attend to in order that everybody, especially when given the appropriate health card that we want to endorse, should also have the appropriate facilities to cater for the needs of our countrymen.
And we have data to support what Benny has just said. For example, there are 1,351 hospitals in the Philippines, around up to 60,000 beds. And we are now 117 million Filipinos, and it's climbing. That's 1.9 million to 2.1 million babies born every year. And the beds to population is now at 1.35 per thousand population, but there are many areas it's only 0.5 or even less than 0.5, especially in the BARM area. So that's not enough. So even if we are so proud of espousing the health card, where are they going to use it if there's no health facility?
Right.
And so therefore, we also thought about technology. I remember when it was the pandemic, I actually initiated the scale-up of telemedicine, remote consultation. So that's possible for remote areas because even during the pandemic, those on lockdown were actually behaving like they were in remote areas. They cannot access any clinic because all were closed, there were lockdowns, and so telemedicine saved the day.
Right.
It's true. Like, in many areas, there's no hospitals, but we have internet connection.
Yes. Yeah, so Mildred, that's why in Heal PH 152, we only have 3 platforms. Okay, namely, which is the Dr. Eric Tayag mentioned, and then to accessibility and health card with General Benny, and infrastructure. And the important one is the number 3, which is to modernize also the healthcare facilities. You have the health card, you have the structure, but you don't have the modern equipment.
Maybe Andrew, I can give them a scenario.
Yeah.
The third leading cause of death is strokes.
Yes.
And I've just confided with a neurosurgeon. Eric, did you know that there is a critical 2 hours between the onset of symptoms that can actually save a life of that stroke patient? But it requires a CT scan. You know why? Because the neurosurgeons or the physician looking at this stroke case has to differentiate whether there's bleeding or not, because it will involve a different procedure.
Intervention.
But should we buy CT scans for every corner? We don't. We don't have all the resources. That's why the Universal Healthcare Act made sure there's a provider network. So if you have a CT scan here, make sure the others can actually use this. So the operative word is making arrangements. How can I make arrangements that a stroke in my area can, within 2 hours, actually reach a health facility that can do a CT scan? So that should be in the planning.
So it's not just limited to government hospitals then. So there's like a network of
Public and private.
public
That's
and
correct.
private.
Because there are areas where the only health facilities that's actually in that area is a private
It's a
hospital.
private hospital.
So it should not make any of us delay our consultation just because it's a private hospital. So when it's a health card, it's a guarantee. I don't have to worry about whether or not the private hospital is going to tell me that I have these bills already, even before they start giving me care. The health card makes sure you do the right thing ahead of everything you're thinking.
Yes, and to add with Dr. Eric's mentioning, no, it's not only the equipment, it's also the training of healthcare professionals. So we have very modern equipment, but apparently we lack training. So it's left out for, just example, nothing, di ba? And then also with only that equipment, we have to also improve, continuing improvement also. So this is a part of a package of the modernization in our healthcare. So not only the equipment, it's also the training.
TJ Mildred, maybe you can help us, because when we were discussing about this health card, this access to, there is one segment of the population that may not be listening to us right now.
Yes.
The youth. Because they think, I'm strong,
I don't
I'm
need it.
healthy. Well, it's the senior, anyway, it's the elder persons, persons with disability, those who have these morbid conditions, just gonna need the health card. We are strong, we're healthy, but remember, okay, you're smoking, you're drinking alcohol, your diet is not so healthy, you're not into exercises, and then what you're doing now is stressful. And in a couple of years' time,
It's
you
your
will
turn.
actually need a health card.
Yes.
And why would you wait when you can be responsible for your health right now?
So the health card is open, no, for every living Filipino citizen.
Yes.
Including OFWs.
Yes.
Okay.
So how do we also make sure that they don't overwhelm, no, our facilities? Because as of this time, part of the limitation might just be people don't go to healthcare facilities is because they don't have the means. Now with the card, they will have the means. So how do we also make sure that our existing facilities are not overwhelmed?
That is why we would want to tap the education sector so that there is a preemptive measure that is undertaken by them so that they do not, you would not want them to get sick. They should learn to live healthy with the proper education. Perhaps that could be addressed.
Yeah. To add, sorry, are you done?
Yeah.
To add what General Benny said, in where I experienced in other country like Australia, perhaps, during their high school years, they were already integrated the healthcare system nila in physical education. They're very good in sports. and in which they teach their kids to be healthy, to eat right, sleep this amount of, and they do it in their school. So preventive is better than curative, right? In Philippine setting, we have that, but however, it's not pushed properly, or it needs a more pushing pa. Yeah. So yeah.
In fact, we look at our situation right now. Hospitals have their own outpatient clinics, and in fact, they have annexes outside. They are found in malls, etc. When we look at the Singapore experiment, they invested more on health centers where people actually live.
In the communities, that's in barangays,
Yes,
right?
so that they can easily prevent it, and not in the hospitals. In the US, for example, they have de-linked outpatient services from the hospitals. In hospitals, it's only patients who will need care inside the hospital. It's outpatient, you go somewhere else. You don't go to a hospital. So you do not create a long line, and the doctors there can now take care of the patient instead of handling between the wards and the outpatient. There are dedicated doctors now, health workers, and even nurses can help. Right now, the nurses are perceived as only assistants to doctor, when in fact they can take care of very common illnesses. So
Yes.
that has to change.
So with that setup, we really need to empower the barangay health centers, which right now, all they do is like injection for vaccines.
Not only that happens because there's no demand. It's demand and supply. So no one's going to the barangay station and health centers. So why would we even have medicines, this equipment? Because everyone goes to the hospital. So it becomes a cycle. But if there's a demand, people are really going to the health centers before they go to hospitals. They will make sure there's medicine, there's laboratory. Exactly, that's what the PhilHealth is doing, the consulta package. But it's not going fast as they have intended it, because local governments have the responsibility. Did you know that Universal Healthcare Act is based on one unique Filipino trait? Bayanihan. It's not just PhilHealth, it's not DOH, it's not all the other entities, it's not the SWD. It starts with us, which I mentioned earlier.
So I think we've covered about healthcare facilities, no? And I think Doc Andrew mentioned a little bit about professionals.
Yes.
Is it part of your scope also to address the growing impression that we have a shortage of healthcare personnel also in the Philippines?
Yes, actually, to correct you with that, no, we don't have a shortage of healthcare professionals. We have a surplus. That's why other countries are picking Philippines, because number one, we have language integrated as English. We speak good language of English rather than other countries. The thing of our students, newly graduate, they just practice 1 year, they just practice 2 years, and they go off to other countries because the pay is good, the training is good. So what we want, Heal PH 152, is somehow to make like a policy that when you graduate, okay, you serve your country 2 years or 5 years, and in that way, we wouldn't have a shortage of healthcare personnel. So this is actually what happened. So we thought that we have shortage of nurses, doctors. No, we have surplus.
Oh.
They just
When I was at the Department of Health, for example, Andrew, we have so many unfilled vacancies because there are changing behaviors of these health professionals. They don't want to be tied up with a certain institution. It's like they're giving services in several institutions on a contractual basis. So they have control of their time, okay? But of course, they don't get the benefits. And we have volumes of healthcare personnel who are having this job order status.
yes.
When in fact,
They're needed.
there's
They're
a law.
supposed.
Yes, when in fact you have a vacancy. And when we ask why are you not giving them the permanent positions, it's the eligibility. For example, there is a strict requirement for any healthcare professional that you should have finished at least a residency training program, etc. And those on job orders have forgotten their dreams. They did not finish any residency training program. They lost the confidence to continue their education, and so therefore they cannot get the position. They're stuck.
There's an interesting information that I would want to share with you. When I was commander of the Training Doctrines Command tasked to recruit soldiers for the Army, many of my soldiers at that time were nursing graduates. So they ended up doing soldiery work rather than doing nursing work for our country.
A mismatch.
Yes.
What about, this is also impression, so correct us also if we're wrong, no? What about also addressing an impression that our doctors and nurses are not paid competitively? That's why they opt to move out of the country, which impacts our healthcare system also.
It has a big impact on our healthcare system. We have good doctors, good nurses, and allied healthcare workers. But apparently, because of the salary grade compared to abroad, it's a wide gap. So they prefer to go to other countries.
But Andre, I'd like to add to that.
Yes.
In the public sector, there's the standardization of salary rates. There's the Magna Carta.
For the healthcare
No,
workers.
it's creating a gap between the private and the public because the private professionals are not getting the salaries they deserve. And so one solution to get out of that is maybe raise it to the living wage standard. So if you're giving an entry position in the private sector, a nurse, for example, at 10,000 per month, and the living wage in that area is 25,000, raise it, and the hospital gets, for example, a tax relief, a tax incentive. So things can be done actually. You can actually make arrangements. That's the operative word. And unless we think about this, we are stuck in that situation that they're not getting their money's worth. But you know, in the public sector, for example, the healthcare professionals, that's why we call them heroes. It's not actually the salary. A smile they get from their patients, they're automatically paid. Relieving the suffering, making sure that nobody dies during their rotation of duty is also a big step for them. But of course, we are by human nature needs to survive economically. And so if we forget that and just give them these words, you are heroes, that will not be enough.
Maybe in the first few years, but later on, you will see that, oh, my colleagues are already way out there and I'm stuck here. So I think that's...
So,
It's gonna be a demoralizing effect.
Yes, and then maybe we can do the standardization and skill-based,
I was telling them when I was starting my career, okay, I was earning 2,000 pesos a month. And then on payday, okay, there are the manas there. Dr. Tayag, it's your fourth give for that for that cent you got from us. Okay. Minus na kagad.
Pagbalik mo, ano na to, papel na lang.
That's happening also.
So I think benefits, additional benefits for healthcare workers, standardization, public and private should be the same. Increase, but based on skills.
But Andrew, Benny, remember, it's not only about these salaries; it's their working conditions.
Yes, working conditions as well.
They're tired. Did you know that others have to work 12-hour shifts? It should be 8-hour shifts. It's beyond human.
Yes, it's true. How can you get
human condition?
How can you get good healthcare when you're abusing the one providing care?
It falls back to shortage of
and
healthcare
it's making arrangements. For example, you have this group of nurses giving their services. Then you have an extra team. Okay, you're monitoring. Okay, get out of that. The extra team is going to take care of your patients now. So you can actually make an arrangement. And we have done this during the COVID. And there's still a pandemic, and suddenly we've forgotten how we did very well during the pandemic. That has to change.
Yeah, it's true. There's a lot of innovations. You know, honestly, we were kind of flexible because
Maybe, Mildred, can you share with us one of those innovations, and maybe we can include it in our proposal?
Oh, like how ano ba yung mga nangyari sa COVID? We were not prepared for it. The medicines, the vaccines, we don't have the facilities, but we survived.
Yeah. Yes.
Diba?
And suddenly, we're losing it again. And so,
bakit ganon? Why? Why?
wala pa kasing Heal PH.
Ayun. Ayun pala yung answer. Wala pang Heal PH.
That's the magic word. Heal PH.
Gusto ko, healthy kayo.
Right.
Yes. Okay, so much as we really wanted pa to get more from you, but we're short of time. Good luck to Heal PH. And belated happy birthday.
Thank you.
Have a belated happy birthday. I think it's a good sign that you guys are celebrating the same.
Yes.
If we were actually sharing food at may takeout, ang takeout namin dito is our conversation, and we have our team. They're actually listing the conversations we had. We're going to review it and make sure that we're able to recalibrate our proposal, because we are really very serious.
And I think health is a very important factor that government should really provide.
Yes. I agree.
Provide funds. Yes, infrastructure is needed, but ano bang gawa ng infrastructure kung wala na yung mga tao na gagamit ng infrastructure? Right? So,
I agree.
So it's been a very good conversation so far, but we're not done yet.
yes.
So for the 5 core questions, we will have them when we come back.
And welcome back. We're back to the second set of our Beyond the Ballot 2025 interview series. We're down to the 5 core questions for our guests. The first question: what are your top legislative priorities to improve healthcare access in underserved communities across the Philippines?
Thank you, Mildred. If we win with all your support for a Heal PH Partylist number 152, initially there are just 2: expanding the Universal Healthcare Act to make sure there are adequate funds that can provide the services we just mentioned earlier. And that number 2, the strict enforcement. We cannot leave anything to chances anymore. Everything has to be by clockwork. And that's the legislative agenda. And we hope that if we win, as soon as Congress opens, ours is number 1 in the agenda. And of course, the health card is our second agenda, legislative agenda, so that it becomes a reality, not a dream, so that our supporters will know that we are really serious about this. May pag-asa ka na sa health card.
So for the second core question, how does Heal PH plan to support mental health programs, especially for the youth and the marginalized sector?
DJ, now that you said that, there's a 2018 National Mental Health Act of 2018, and we are looking at slow progress of this Mental Health Act, especially that it has organized a council already. They need funds. You need funds for medicines. And Mildred said a while ago, for example, DJ, that it's not about this psychosis, this mental health illness, the well-being, because there's no health without mental health. For example, for the youth, we make sure we reach out to them. And basically, the law says that there should be community-based services for them. We have to make sure, the Heal PH Partylist wants to make sure that this really happens. We don't want to have Filipinos having these mental health issues, not now, not tomorrow, because everybody should be healthy, physically and mentally.
For our third question, what specific policies do you propose to ensure better working conditions and fair wages for our healthcare workers?
Okay, Mildred, that's a very interesting topic and it's a very good question. We want to have a standardized wages that's including private hospitals. If you notice, private hospitals has smaller wages compared to the public hospitals. So we want that standardized across the board. And then also what we can do is we want to make it as a skill-based salary grade system. No? So if you are longer in the healthcare system, you have higher pay scale. If you're well-trained, you have higher pay scale, just like in other countries. So you start with nursing number 1 or in medical number 1, then you have this much salary. If you are in the grade, let's say 5, you have a higher scale. So depending on how they train, okay? And then another thing also is I want to emphasize is better working condition, because most of our healthcare professionals are working to their maximum energy. Instead of working 8 hours to 10 hours, sometimes they are extending their hours to 24 hours or even 16 hours. Sometimes they have double shift already, and sometimes it does not permit you. So if you have extended working hours, chances are you have a high chance of making a mistake. That's why when I work in abroad, they are very particular of your number of hours. That's why we can integrate it here and make it as a policy. And then also your patient ratio to healthcare staff. In other countries, you only have what? 8 to 10. Here, you have 20 to 40. Oh my gosh, can you do that? Maybe, but not forever. So that's why we have to set limits. We have to have standardized. We have to have good policies. We have to learn from our past. And then another package is what we wanted to do is the benefits for the allied healthcare personnel. Now, in doctors, they have this extra share in PhilHealth, but some of the allied healthcare does not.
For the fourth question, how will your party list address health infrastructure gaps, particularly in rural and far-flung areas?
That's correct, DJ. The gaps in our infrastructure in health services, particularly in the rural areas, is precisely why Heal PH, number 152 in the ballot, would like to pursue our agenda. And these gaps is more or less become strained or underscored because the focus now of the Department of Health has been in building specialized hospitals, leaving the rural areas, the support for the rural areas already undermined. So we would want at Heal PH to channel more funds from the national government to support health services at the barangays and the rural areas. And we will need this so that we could establish our priorities. We will need a mapping of the infrastructure. Remember that infrastructure does not only mean facilities, it also means all the other arrangement that comes in providing for the health services, such as personnel or doctors, modern equipment to cater for the health services that are needed in the barangays. And this will need also inviting our private partners to support us in the light of corporate social responsibility. And all of these we'll have to put together so that we need Heal PH Partylist to orchestrate all of that and put it in a policy for government to implement. So don't forget, vote Heal PH Partylist in this coming election number 152 in the ballot.
For our last question, what is your stance on public versus private healthcare, and how will your policies balance both sectors to serve the Filipino people best?
Let's do away with competition. Let's do collaboration. And the private sector can actually help with our gaps in infrastructure. We mentioned earlier that the national government has made their sights on improving the modernization, especially with specialty centers, with government or public hospitals. This left local governments with not enough funds for their own infrastructure. The private sector can pour funds and build what local governments would require and get tax incentives.
The Filipino people is watching. Your closing messages.
Okay. Thank you, Mildred. This coming election, please don't forget, Heal PH po, 152 sa balota. Now, what we can offer is only 3. Health card, modernized hospital facility, and accessibility to hospital care. So, again, 152 Heal PH po.
Okay, Mildred. Sa mas maayos na pangkalusugan sa kapwa nating mga Pilipino, tandaan, ang party list, Heal PH, number 152 sa balota, iboto sa darating na eleksyon.
During this Holy Week, include in your prayers that we will be successful in our advocacy. May pag-asa ka sa health card. But more than that, gusto namin healthy kayo. But please also remember this. Of all the problems each one of us will encounter as life goes by, it's the health problem that's the root of all our problems. So why not start with health? And the Heal PH Partylist is your companion for your health needs. Vote Heal PH Partylist number 152, and that's on May 12th. Remember, please vote.
So that wraps up our conversation with the nominees of Heal PH Partylist.
And we'd like to thank Doc Eric Tayag, General Bennie De Leon, and Dr. Andrew Jimenez, and of course, Captain Edison Chowa, who is joining us here at the studio, for joining and sharing their insights and advocacy.
Mildred and Jane, not to interrupt you, here's the health card.
We hope we gave you a clearer picture of what Heal PH Partylist stands for and how they aim to serve the Filipino people through representation and legislative endeavors.
As voters, it's important that we look beyond slogans and dig deeper into the people and the platforms behind each party list.
So stay informed, ask questions, and vote wisely.
So this has been another episode of Beyond the Ballot, brought to you by SunStar Cebu.
I'm DJ Moises.
I'm Mildred Galarpe.
Thank you and good afternoon.